My name is Jennifer Martinez, and this is my presentation on aspects of education in childhood asthma. This next video summarizes how important it is to start with early education about asthma. I thought it was a perfect video to go along with my presentation.
It's nothing to sneeze at. A growing number of children are being diagnosed with asthma.
They're saying now that 3 of 30 kids in a classroom have asthma.
Asthma is a potentially life-threatening lung disease that inflames and constricts the small airway, making it hard to breathe.
The problem that sometimes is being overlooked by the family because the kids with asthma have several signs and symptoms that may be missed.
Educating the family, including the child, is critical. Teresa Sumi directs the Asthma Health Management Program at Lee Memorial Health System.
We originally started seeing children 5 and up, and then we realized with the rise of asthma, we definitely need to be teaching all ages.
Knowing the signs and symptoms of asthma is the first step.
Cough is the #1 symptom of asthma. A child being overtired, shortness of breath. A lot of children will say they have chest tightness.
Also important, recognizing things that might bring on an attack. Changes in season can trigger asthma episodes because of an increase in pollen, especially light dry pollens found in trees, grass, and weeds, because they tend to get airborne.
The younger children tend to be more susceptible because their airways are smaller. Their immune systems are not as developed, so they tend to catch more of the illnesses and things that can trigger the asthma.
A new study shows 1 in 3 asthmatics haven't been taught how to respond to an attack, making it especially important to begin early education. For Lee Memorial Health System, I'm Amy Osher.
What we can take away from this video is that asthma can be manifested in different patients different ways. Kids with asthma may be having symptoms that are being missed, and 1 in 3 asthmatics are not taught what to do with symptoms. This next slide is just some facts about asthma education in children. 56.4% of patients report not receiving education about asthma. Bronchial asthma is one of the most common medical conditions in the pediatric subgroup worldwide. In the United States, frequency of visits to the ED and hospitalizations by asthmatic children is more than twice as that for adults. Lack of knowledge on how to use meds or negligence to follow instructions of use are major causes of relapses. Various studies have shown that when a patient is given instructions and proper education on mild attacks can be managed at home and thus decrease significantly the number of days per month with daytime asthma. Educating a patient at home is the key to decreasing unnecessary visits and use of resources. 9 out of 10 asthma deaths could be prevented each year. 1 in 10 children have asthma. In 2010, 3 out of 5 children who have had asthma had 1 or more attacks in the previous 12 months. Prevention is key through education. With this slide, the 3 most important topics of asthma education. Most important is to show how to use medications that are prescribed and what each medication does. And then the second one is a very simple explanation of what asthma is and what it does to the body to make it appropriate for the children to understand and their parents. And the third most important topic is to explain how to prevent asthma attacks through teaching of prevention and symptoms. This slide shows a roadmap or a pathway, asthma pathway, that kind of gives you a guideline on how to teach patients and parents. So The A portion of the pathway says we should review a simple physiologic explanation of what asthma is. S stands for symptoms. We need to make clear to each patient individually what the possible symptoms of asthma are and how we control those. T is for technique and triggers. We should be assessing how the parent and patient administers medication, such as do they utilize a spacer, do they make an appropriate seal, do they inhale too fast. This is where you discuss triggers like what is bringing on the asthma attack. H is for help. We should be discussing with parents and patients where to go in case of an attack and what to do to maintain them until they get there. M is for medication, which you should review each medication and what they do and how they make you feel and the side effects. And then A is for asthma action plan, and this is just a plan to guide the families on what to do in the different severities, mild, moderate, and severe of asthma. And it's been said in literature that individualized action plans have proven to be an important aspect of asthma control, and it lowers risks of exacerbation. Why is it important to teach children about asthma? The importance of teaching children and families about asthma is because overall the patient's quality of life can be improved because the patient can have less attacks. If they are well maintained, less hospital admissions, they can live a healthy, normal, active life. The patient learns how to take their medication, and as a result, they actually take their maintenance medications. And it can cost the patient's family a lot less if they don't get admitted to the hospital because of proper maintenance. Unless you miss school less, parents miss work less. This is a chart of a graph showing the number of hospital visits for asthmatics before they're educated and after they're educated. And as you can see, the amounts of visits were significantly reduced after the patient was educated. And here we discuss factors that can affect parents and children's capabilities of learning about asthma. So, of course, patient age is a factor, and it can affect what the patient retains and the knowledge that they can retain because of their mental capacity. So you must have appropriate age-appropriate material to teach your patients. Cultural and health beliefs. Certain cultures believe different things, and maybe they think there is other cultural meds or rituals that can help the condition, so they tend to be reluctant to adhere to treatment. So you have to take this into consideration when attempting to educate parents and patients. Health literacy is another factor that affects the capability of learning about asthma. And health literacy, if a caregiver of the child has low health literacy, then it is likely that the parent has low knowledge of asthma and low knowledge of how to manage the disease. It is difficult to teach parents who do not understand these types of families do well with visual aids. Costs of medications are high, and some patients try to go without because of the cost. Some patients' parents do not understand how important medications are. Psychosocial factors. The burden of living with asthma can result in depression and anxiety for the patient and or family, which can compromise education of asthma. If they're depressed about the situation, they're less likely to retain information. Education should be given in multiple settings. School settings, it should be given in clinic settings and in the ED. and home to be given the best opportunity for patients to learn. This is a quote by the National Asthma Education and Prevention Program. And they basically say the ultimate goal of both expert care and patient self-management is to reduce the impact of asthma on related morbidity, functional ability, and quality of life. And the purpose of asthma education is to help the patient or parents develop knowledge and skills to know when asthma is worsening and to take the appropriate action to be motivated to avoid triggers and adhere to a management regimen. These are my references. They are listed in alphabetical order, and this concludes my presentation.